So for those of you who don't know me, I'm Bob Hornstein. I'm the Director of Community Relations and Public Affairs for the Jewish Federation of Greater Portland. And this is our 8th Zoom Community Forum. As many of you know, we did one yesterday afternoon with a couple of leaders from the local African American community. And I think that's just a great segue to today's program because as we all know that the African American community has been disproportionately impacted by the COVID-19 virus. And now, given the current state of affairs in our country and in our city and cities, we see the large protests, peaceful protests mostly, and we're concerned, of course, about the lack of social/physical distancing. We even see some protesters that are not wearing masks, and so the concern there is the possibility of another spike in the virus. So today we have 3 guests, and I will introduce them. So what we're going to do, I'll introduce each of them. They'll make some opening remarks. And then from that point, we have a couple of quite prepared questions that we'll ask, and then we will ask participants to go ahead, put your questions in the Q&A. If you don't mind waiting just a few minutes before you type in your questions, that would be helpful to us. The chat function is disabled, so you have to use the Q&A box at the bottom if you wish to ask a question. We'll try to get to as many of those as we can in the next 55 minutes or so. So with us today, we have Matthew Green, who is the Senior Policy Advisor of the Oregon Health Authority. And we have Jackie Yerby, who's the Deputy Health Advisor for Governor Kate Brown, and her colleague, Soporn Chiang, who's the Director of Equity, Diversity, and Inclusion, also for the governor. So Matthew, I think I'm going to look to you first to make your opening remarks.
Jackie, do you want to go first? We had gone back and forth.
Sure.
I'll let her do it.
And Matthew and I talked a little bit before this call, just to talk about a little bit of flow. So as you may be aware, the governor held a press conference earlier today to talk about moving into phase 2. And I don't know if you are signed up to receive emails with the governor's press releases, but the one that came out after the news conference does a really good job of summarizing where we are. So I can talk a little bit about that, and I'm looking at the news conference, and so sorry about the press release. So so the counties that are currently in phase 1 that have been in have been in phase 1 the longest are now eligible to apply to enter into phase 2, and that we're continuing to take a county by county approach to reopening, and that they can only be approved to enter phase 2 if they've been in phase 1 for at least 21 days and are succeeding in controlling the spread of the virus. So they need to continue to meet phase 1 metrics, including declining disease prevalence, having an adequate number of contact tracers, including people who are reflective of the communities they serve. We want to make sure that we are doing contact tracing using trusted community resources, and that they're doing it in a trauma-informed and culturally responsive way. And that counties must also establish adequate testing, tracing, and isolation and quarantine facilities, have sufficient hospital capacity, and sufficient personal protective equipment. And then they must also meet additional prerequisites, including demonstrating that they're able to trace new cases within 24 hours, and that as counties are seeing new cases, they must be able to identify where they are coming from at least 70% of the time, and that counties can't be experiencing a significant increase in cases. The governor has a coronavirus website. It's coronavirus.oregon.gov that is a great kind of landing place for lots of information about COVID-19 and the state's response. And one of the links on there is to today's press conference. And if you have some time on your hands, I would encourage you to take a look at it. I think there's a lot of really good information and really good tone setting coming from the governor, as well as from Oregon Health Authority Director Pat Allen and State Health Officer and State Epidemiologist Dr. Dean Seilinger. So lots of good information shared in that, lots of good data that I won't even begin to try to recreate for you, but just wanted you to know that that was out there as a resource for you. And I think with that, oh, I guess I will also say some new guidance for phase 2. So counties that enter phase 2 will be able to continue with the reopening process following updated health and safety guidelines. So as I'm sure you're interested to know, gathering limits will be raised to 50 people indoors and 100 people outdoors. Indoor and outdoor venues, including theaters and like faith-based spaces that allow for at least 6 feet of physical distancing and other protective measures in place, can reach a COVID-19 occupancy limit up to 250. And that guidance is being developed. It hasn't been finalized yet, but it should be finalized very soon. And then as far as offices that they can reopen and employees can return to workplaces with physical distancing and other safety measures in place, though we're still encouraging remote work. We're allowing increased travel throughout Oregon, though staying local is still recommended to prevent overloading county health systems. Restaurants and bars will have curfews extended to midnight. Pools and sports courts will be allowed to reopen under new guidance. And indoor and outdoor activities such as bowling, batting cages, and mini golf will be allowed to reopen under new guidance. And recreational sports can resume in a limited form under strict physical distancing guidance. So, so you can find a lot of this information again on the governor's coronavirus website, which is coronavirus.oregon.gov. And I definitely want to leave room for questions, but I'll say, Suporn, is there anything that you'd like to add to what I've said?
Yeah, thank you, Jack. Oh, did you all hear me okay?
Yes.
All right, well, thank you, Jackie, and Bob. Thank you so much for the introduction and also the invitation for joining the conversation today. A couple of things that I just want to highlight to add on to what my colleague Jackie mentioned, that the governor is really approaching this with her priority that to keep the Oregonians safe and healthy. So one of the actions that we are working closely with the Oregon health authorities around the culturally specific testing and contact tracing capacity. So and what we have been working with the Oregon Health Authority and also the local public health. And maybe this is an area that Matthew can also speak a little bit more on this as well, if there's any questions further. But we have been able to set up the community-based testing site in Portland, Salem, and Woodburn. So the one in Portland, as far as I know, is going to actually start this Saturday. It's going to be at the Cell Enhancement Inc. Those are the community-based testing site. And you know, again, this approach because we know that because of the COVID pandemic. Now our communities of colors are disproportionately impacted, and the data has showed that, and there's still a lot more that we have to do to make sure that we collect those race and ethnicity data. But those are, just so you know, too, it is one of the top priorities for the governor to make sure that we continue to address that. What is the data that's missing, and how we continue to partner with the community-based organization, make sure that our approach and what we do is come with the culturally specific and responsive. So for what's all of the work that's been happening. I'd like to say that we greatly appreciate all the partnership, even having the conversation today, any input that you can share, but this type of conversation that really inform us as we moving step by step. And as the governors mentioned this morning, it's about 35 counties right now that make up about 80% of our population are now in phase 1. Jackie already mentioned that some of the counties actually putting up application for phase 2. As far as we know, that is only Monoma County that has not really started yet into the phase 1. And any county has to be in phase 1 for 21 days. And they have to be in phase 1 for 14 days in order to be able to apply to get into the phase 2. All of this information that both Jackie and I share is also available on the governor's website. Both Jackie and I will make sure that you have a link if Jackie has not typed a link yet, so you can find out more details and the information, and we'll leave room for questions later. Thank you. With that, we'll turn over to our colleague at OHA, Matthew.
Well, thank you. Thank you to Bob and all of you for having me here today. So I'll talk for a couple minutes each on a couple of topics. One is some of the numbers by way of getting to who is most affected in Oregon by COVID-19. And then about the public health underpinnings of the guidance in general, in the kind of the bigger picture, and maybe we can have more specific questions about individual pieces of the guidance later, but kind of hit the big picture of what the guidance is about. So start with the numbers. As of today, we had just about 4,400 positive cases of COVID-19 in Oregon. About 800 of them have been hospitalized at one point or another. And there have been 159 deaths as of this morning. Depending on which day you look and which statistic you're looking at, that ranks about 5th lowest in the country by state per capita. So more or less 45 states are actually a little bit worse off than Oregon is right now. The cases and hospitalizations and the deaths are not randomly distributed. They affect some people or some populations more than others, and for several factors. One is age. In absolute terms, the largest number of cases is among middle-aged people, 30 to 60. But if you look at per capita terms, it's actually among the oldest members of our community, people who are 80 and older, that have by far the highest rate of per capita cases. And sadly, some of these are often in nursing homes and other kinds of long-term care facilities where there have been outbreaks. It's one of the highest risk spots in the state. Not the only one, but one of them. Related to that, the hospitalizations and deaths, if you look at those numbers, are even more strongly skewed toward the oldest populations, roughly half of all of the deaths among people who are older. Associated with that is also people who have underlying medical conditions. And by that, we mean things like heart disease, lung disease, renal kidney disease, diabetes, things that are long-term chronic conditions that tend to lower your health, lower the ability of your immune system to fight off, in this case, a virus or a bacteria, that it's kind of common with some other things like pneumonia and influenza, where an underlying medical condition can make you more susceptible to having the more to more severe symptoms. That does not mean that people who are healthy or people who are young cannot get this. They can pass it on to others. There are very young children who've been hospitalized as a result of this. We haven't had any deaths among younger people yet in Oregon, but I think there have been some elsewhere. So it's not impossible, and it's certainly not impossible for people to transmit it who are younger, but the more severe symptoms have been older people and people with underlying medical conditions. Furthermore, even beyond that, as mentioned earlier, this is not evenly divided based on race and ethnicity in the statistics that we see. It hits populations, communities of color, more than it hits others. To look at the numbers proper, and forgive me a little bit, I'll blend race and ethnicity a little bit in these statistics, which isn't always demographically accurate, but starting from the most cases per capita, It's Pacific Islander, Hispanic, American Indian, Alaska Native, Black, Asian, and then finally white. That is a pattern that we see a lot in public health. It is associated with basic structural bias and racism in wealth, in access to healthcare, in the kinds of jobs that you do, say working very close to somebody in a processing plant of some kind, which food processing plants like that are also one of the major sources of outbreaks. Places where, frankly, it doesn't have to be food, any place where people are tightly kind of crammed together. People who work in an office, or certainly who can work from home and telework, much less of an issue. And all of that is associated with demographic factors, including race and ethnicity in our society. So that in part is why a lot of the focus of OHA is on things like the testing sites that were mentioned. Those are, I think, selected because they're in communities where they've been hardest hit, and when there is a highest proportion of people who may not have good access to primary health providers or other places where they can get testing. So move over a little bit to the public health basis of the guidance. There's guidance on the governor's website, it's also on the OHA website, it's the same stuff, about both in general and a variety of specific sectors. And there's more coming associated with phase 2. A lot of it is fundamentally the same, or at least it's based on the same basic principles. The basic question is, how do you go about daily activities as much as possible, as close to normal as possible? If you define normal as what we used to do 4 or 5 months ago, in a way that minimizes the possibility of transmitting the virus from person to person. So 6-foot distance. We know that, frankly, the easiest way for the virus to transmit is from small particles. I'm probably getting a few on my keyboard right now. Small droplets of water with virus in them that just as you talk, as you go about your daily life, you shed them essentially. So can you stay far enough away from people that you don't transmit it to them? Can you wear some kind of face covering? Doesn't have to be a medical grade mask, obviously in medical settings, sure. But outside of that, can you wear a face covering? Which, by the way, face coverings are not designed to protect you. They're designed to protect everybody else that you might breathe or cough on if you have it. So please think of masks as something that you can do to help everybody around you. Cleaning things, because those little droplets get on your fingers, get on the things that you touch. Avoiding passing things from one person to another that might touch those before they die off. Eventually, a virus sort of left on its own will die. We don't have exact times. It probably will happen faster if it's hot out and sunny out, but wouldn't count on that. You know, don't wait 30 seconds and assume it's safe. Avoid passing things from person to person. This especially comes up in guidance around things like restaurants and other places where they might hand things around. What else am I missing? Know the symptoms, such as, the biggest ones are coughing and fever, also shortness of breath, and there's others, and those are listed on our websites. And if you have those symptoms, please stay home. You are at higher risk at that point of sharing the virus with somebody else. If you have been in close contact with someone, we urge you to stay, who has those symptoms, we urge you to stay home for the same reason. Vulnerable populations, the one that I just talked about, we urge you to stay home, even as we reopen. If it's particularly vulnerable for you to be out because you know that you have an underlying medical condition for someone, it would be much more dangerous if you were to get it. We urge you to stay home. Cleaning and disinfecting things regularly, perhaps much more often than you might normally have done. All of this is reflected in different ways in the different pieces of guidance. And also I'll throw in, it's not just the official guidance that, as we've posted the guidance on the website, we've gotten a variety of questions. Well, what about this situation? What about that situation, and so forth. And so we've tried to add frequently asked questions under all of them. So there's kind of a whole variety of things you might want to go look at. With that, I'll leave it open for questions.
Thank you to each of you. So just to clarify, has Multnomah County even applied for phase 1 reopening? They have, okay. So That's
I think they will be. I think they're applying by Friday. It was my understanding, but Saporn, you may have more information than I do. But if they haven't already, they will be applying for phase 1.
okay. And I'd like you to discuss the context, which seems to obviously in the last 8 days, 9 days, has changed dramatically with the protests and the lack of social or physical distancing. I'm wondering if you can comment, are you concerned about a new spike? And in terms of testing and capacity for contact tracing, what do you anticipate as a result of these protests?
So I'll start, and then we'll look to my colleagues to add on. Any place where people are gathered and aren't either practicing or able to practice the things that Matthew mentioned, right? The 6 feet of social distancing, the face coverings, the not coming into physical contact with each other, being able to practice like good hand hygiene, those kinds of things that it increases the possibility of spread. And what we know, and I may have to, I'm looking at Matthew, is the incubation period is 14 days. So it's going to be 10 to 14 days before we really know what the impact is. And I'll just segue to say the reason why we really want to limit gathering size is to basically contain spread, so that if there is spread, that it's happening within a smaller group of people where it's also easier to do contact tracing. So obviously a gathering of thousands makes that a lot more challenging. And I want to say the governor was asked this in the press conference today. And we also absolutely respect people's right to gather, to protest, like in the face of the recent spate of racist actions that in some cases have led to the death of Black Americans. So we want to absolutely respect that, their right to gather and to protest. And I think the governor said it repeatedly throughout, like, please wear face coverings, please try to keep like a physical distance, please practice good hand hygiene. If you're gonna cough, cough in your elbow. So we're trying to square some difficult things here. I don't know, Matthew or Saporn, do you want to add anything to that?
The reopening requirements of the counties is built around them having capacity for contact tracing, for isolation, for basically being prepared for a potential spike in cases. Now, when that was originally done several weeks ago, we didn't have these rallies or protests in mind. We did have the concept of there is a potential of an increase in cases in mind.
Yeah.
And so the guidance focuses on and the requirements for reopening and potentially, if worst case scenario, of going back in a phase, right, is around, can they trace first of all, does the tracing get done quickly in 24 hours? When you trace it, are you able to trace at least 70% of them to known sources? And the difference there is if it's a known source, you say, it's in the family, for example, it's not good that somebody has the virus now, but it's more manageable than if it came from we don't know where. Right. So it's clearly out in the community circulating in a way that we don't know about. And so And then absolute worst case scenario, making sure we had hospital capacity, which it's so far, thankfully, hasn't been a problem in Oregon. It has in some states. That's why we continue to focus on it. And so it may be difficult at the end of the day to determine whether a particular increase, if there is one, is associated with particular events or not. I don't know. We'll have to see if it's in certain counties or not. There could be in any circumstance where there are people kind of very close together, if they're not being careful, where there could be higher rates. And just the whole reopening could potentially lead to that. We've tried to design it to be able to identify that and respond to that quickly, if necessary.
Yeah, and if I could just speak to that really quickly again, I keep pressing the governor's press conference. OHA Director Pat Allen gives some really good data about what's happening in counties that have been in phase one, and that while we expect that there will be an increase in cases anytime we loosen restrictions, the numbers actually look really good. And that's all I'm going to say, just because Pat does such a better job of walking through that. So I would encourage you, if you're interested, to take a look at that.
I just wanted to just clarify, the question, Bob, you mentioned about Monoma County, and Jackie mentioned about a Friday. That was what we heard, and I think that is also for many of you probably pick up on the news that they're about last week that they might open they aim to open around mid of June. I think around June 12. As of right now, we have not officially received any application yet. So any things that on the website that Jackie just shared on the governor's website, there's the information around the status update for the county who's already in phase one, but it also give you an idea of like who's actually already in phase two. And I think that it would be good for us to also share the link that Cynthia speaking about the data and some of the information. OHA, the Oregon Health Authority, is doing a great job putting together the daily update as well as a weekly update that really lay out under the breakdown of the race and ethnicity. There's still some piece of it we still need to work on that, but it's also show like by age and also by the zip code. We'll make sure that we post that on the links as well. Okay.
So we have questions about testing. One of our participants is asking if it's true that Oregon is one of the lower ranking states in terms of testing capacity, and if whether that's true or not, if you can answer, what is the goal in terms of tests per, I don't know, per week or month? I'm not sure how you measure it, but what are you hoping for eventually?
That's, yeah, I'm glad you put it in that frame a little bit. We are, I think, toward relatively low in terms of number of tests per capita. There's a couple of things in there that would make us basically not as worried about that. One, the capacity, much of the capacity, not all of it, but much of the capacity is actually in commercial labs that for the most part are not located in Oregon. They're in a handful of states where people from all across the country send tests to. Now, these are labs where if you go in normally to the doctor and they say, oh, I need you to get a such and such test, they'll take a, I don't know, blood sample, urine sample or something. Unless they have something in-house, they'll send it off to one of these labs, literally in a different state, and it comes back. This is a common thing. They ramped up for COVID-19 once it started. And that's the largest body of tests. Others are in hospitals that have their own capacity, and there's a small portion that is very focused on certain high-risk populations at the state lab. That's the only part that's actually state controlled. So our capacity is actually not a very useful number because it's really, however, the national labs are doing a whole bunch for a whole bunch of states. How much of that do we ask for? At this point, our guidance says that anyone who, if their doctor thinks that they have a clinical reason to get it, which mostly means do they have symptoms, have they been in contact with someone, if they don't need public health permission to get a test, so they can go to a doctor and say, the same basic principles of, I think I have influenza, or I think I have a bacterial infection. Or if the doctor thinks that, they can get a test for it. We have not heard of major challenges in that regard. The challenge is in some places in people who do not have access to healthcare as much. And that's what some of these community testing situations are for. And then the other fact, the statistic we've been watching very carefully is the rate that comes back positive. That number has been going down. We have one of the lowest in the country. It's a moment, it's depending on if you look at the last week or so, it's under 2% come back positive, especially as we've reopened. They've actually gone down. What that tells us is that we are testing more and finding about the same percentage or same number, which ends up in a lower percentage, which tells us that we're not finding big pockets that we didn't know about, or that we're not finding we're not even finding kind of more cases as we test more. The number of cases, it varies every day. It bounces around a little bit, but it's been basically flat. So for all of those reasons, the number of tests available is not one of our big concerns at this point.
Okay. So you have counties, even in the metropolitan area, that are in different phases or no phase at all. And obviously, you're going to have people traveling from one county to another county, maybe a county that's still having, an increase in cases. What's the message going to be to make sure people stay safe as they begin, especially in the summer months, they begin to travel more and maybe get outside more, gather more? Is there going to be a change in the messaging?
Travel is a concern. I'll let Jackie maybe talk more about maybe if there's any messaging plans, but yes, travel is a concern. In part because it's just more contacts. I mean, I suppose it's possible to travel without coming in contact with too many people, but it just means you're out and about more. And the other is that it creates a greater opportunity if say the virus is circulating more in one community than in another. In the community where it's not really circulating much, you probably could walk around and talk to everybody and not wear a mask and get away with it if you knew that. It's not something we can easily tell you. But if you go then to another community where it is circulating, or vice versa, something from that community comes here, then it obviously creates opportunity to start a new pocket. That's why we have encouraged people to try to do recreation near their home, things like that. I think that's going to be an ongoing concern that we're going to have to watch. I would continue to recommend, I don't know about any formal requirements, but we recommend staying kind of in the vicinity of your home.
Yeah, and that is the message, is that we're still, people can extend their reach, but we are still recommending that people stay local. And as far as the messaging, I mean, again, Governor talked about using the words that Governor Cuomo used to describe Oregonians when we sent 140 ventilators, that Oregonians are kind and strong and smart. And so she asked us to continue, practicing that kindness, wearing face coverings, keeping physical distance, good hand hygiene, covering our cough, that we're looking out for each other. And so we know that people are going to be traveling more, and we'll be talking about that. And each step of the way, we will still encourage people to use the measures that we know right now as the effective measures to prevent spread. And that those are the things that we've been doing for months now.
So we have a lot of parents of school-age children, and I know everything is very uncertain. What are you hoping to see by September in terms of reopening the schools?
So broken record here. Governor got asked that question in the press conference and addresses it. And so our policy, education policy advisor colleagues have been working with the Oregon Department of Education pretty much since we closed schools down to develop plans for what reopening schools looks like. And so we are really aiming toward having kids being able to return to classrooms in September for all the reasons, and trying to do it in a way that's safe. Like what exactly that looks like, I don't know. I think that's all still being worked out, but we recognize the value of kids being able to return to school. And one of the considerations that we had as we were talking about shutting down schools is what happens to youth who rely on schools for meals and for access to healthcare and things like that. And we wanted to make sure that that we had infrastructure set up to address those needs that weren't going to be met in a school-based setting. So so stay tuned, and I'm sure that when it's ready, we'll share it because everybody wants to know.
Sure. So related to that are questions about childcare. How is that going to look? And then we also know the governor came out and decided that overnight camps will not operate over the summer.
Yeah.
We have a couple of camps here in Oregon. One particular that's very large, the B'nai B'rith camp down on the coast. And I know the governor's been in discussions with the leadership of B'nai B'rith camp. Can you just maybe talk a little bit about the process, what went into the final thinking about the need to close the summer camps?
The overnight camps as opposed to the day camps.
Yes,
yeah.
the overnight camps.
Matthew, can you?
I don't have specific information about day camps. I'm not closely familiar with the details of that or the basis of it, I'm afraid.
So I also didn't work on the summer camps guidance. Our colleague Leah Horner has worked on it, and and probably another colleague who works on education generally. And so I can't speak to the specifics of why the thinking between allowing summer day camps and not overnight camps. But I will tell you that having worked on guidance for the personal services sector, so haircuts and things like that because those fall into my portfolio, that we did that work in consultation with representatives from I guess in this case it would be camps. In my case it was barbers and hairstylists, and then working with folks from the Oregon Health Authority and including a senior health advisor. So really trying to marry up the principles that Matthew talked about, that those are foundational to the guidance, and then hearing from people who are doing the work and how do we make these things work in such a way that allows that that particular sector to operate safely. And so the fact that the decision went against reopening overnight camps makes me think that they felt that it couldn't be done in a way that they felt safe. And I want to say these discussions aren't all about risk aversion, because if we were completely risk averse, we'd be in our houses until there was an effective treatment or vaccine. And so again, it really is, how do we make this work given these foundational principles about keeping us safe?
And speaking of keeping folks safe, especially those who are most vulnerable, the Jewish community has a higher percentage of seniors than the case in the general population, what advice is there for seniors wanting to re-enter into the, into life again?
Well, be aware that of the risk that it is dangerous. I'll tell you, early on, I asked my parents to stay home. My mother hasn't left the house except on the back deck in several months. My father goes to the grocery store a couple times a week. He's safe. He wears a mask. He goes during the relatively quiet times. Again, it's not that they are more likely to get it. It's that they are more likely to suffer more severely if they were to contract the virus. Think about their own health, think about their own position, think about what they're doing when they go out. If they go for a walk, there's not a crowd of people around, go to sit in the park. It's not about that they can't leave the house or engage in society. Please do. Think about how closely you're going to become in contact with people that you are not in contact with every day. Think about wearing a mask when you're out. Think about the surfaces. Are you handling things or touching things that other people are touching who might have potentially? You should probably just kind of assume that everybody around you has the virus. Think about how you apply this kind of guidance, the same basic issues that I've talked about in your day-to-day life. How do you maintain separation? It's not an easy thing. I would urge people to be cautious. You probably err on the side of being safe. I don't think anybody at this point will hold it against you if you wear a mask and stand further away. I think socially that's very acceptable at this point. In fact, almost becoming socially required. Which for a little while is a good thing until there is a reliable treatment or a vaccine. Look for other creative things online, phone calls, FaceTime, whatever it might be. But please do be careful.
So I'm sure I'm not the only football fan on this Zoom. And, we're all wondering about college football. And I'm wondering, is the governor, is she in communication with the universities, with the Pac-12 commissioner about the possibility of what college football could look like with social distancing? Has there been discussions about that?
I've not been part of them, but absolutely yes. And she also, sports was a question that got asked today. So, and I believe she talked about like Oregon athletes, collegiate athletes returning, I think mid-June to start training. Again, trying to have those like underlying protective things in place.
So I assume testing will become extremely important as far as.
I'm not exactly sure how that's going to work. And I mean, one thing about a test is a point in time. So, I get tested like right now, and I test negative, like right now, I don't have COVID-19, but I could go out and somebody sneezes on me. And then, 5 minutes from now, and I might get COVID. And then there's the whole thing about like what kinds of tests, right? People talk about the antibody test. Well, it takes a while to develop antibodies. And so we're not really recommending that as to find out if you have it. So absolutely more testing capacity, but it's like a couple of days ago, I was on the call with the governor's medical advisory panel, and we were talking about testing in long-term care facilities. And I don't know if you've seen any videos of the test, but man, that thing, it's like it's tickling your brain. And that may be traumatic for a senior, especially a senior who may have cognitive limitations. And so just really thinking about again, and the test is a point in time. It's not protective. It just lets you know, do you have it right now? And so I keep going back to the fundamentals of how do we protect ourselves in the absence of an effective treatment or a vaccine.
Yes, prevention is frankly more important than testing, because prevention will stop you from getting it. Testing will only tell you that you didn't have it yesterday.
Yeah.
Well, speaking of vaccines, we know that one may not be ready for several months. And so one of the questions that we have is, access. How will they be distributed, and how will they be distributed, making sure that they go to the most vulnerable among us, and certainly first responders, but also, communities of color, for example. What's the plan for making sure that those who need it as a priority get it, and then, the rest of us?
I think you just started listing some of the factors. I don't believe there is strictly a plan yet, because it's further enough out, but those will all certainly, all the people I mentioned are at high risk, the communities that are suffering from it more, people who we don't have currently good access to healthcare. We'll have to find out, ways to make it accessible for them. The first responders, people who are who for whatever reason in their job are out and exposed more to people. It's far enough away that we've focused on other details of immediate response, but yes, I think you hit a bunch of the criteria.
And I can add a little bit to that too. Thank you for the question, Bob. And just so you all know too, when it comes to the vulnerable populations and the communities of color, that is part of the governor's top priority, and she wants to prioritize that. Since vaccine is just way further down the road. I mean, this is some things that it's been part of the conversation, but what we would like to focus right now is around testing. Who can access to testing? Can we make sure that there's a community-based site that is culturally specific, and allow the community? Matthew spoke a little bit earlier around the accessibility and also the healthcare access, because there's still many of our vulnerable communities member, especially the communities of color, they don't have the access to the healthcare. So it's hard for them to walk into the hospital and assume that, even though we have been promoting and let them know that all the testing is free, but still they don't have that trusted organizations and the partners who are on the ground, who they know and they trust them, that being able to help to educate. It's still the word out there in the community that it's going to cost money. They're afraid that if they're going to go and trying to get tested, they're afraid that what's the bill going to come after that. So that is kind of go back to prioritization. Definitely, once we have that plans in place, looking into who should be the forefront and our most vulnerable population, how we going to center equity and make sure that our communities of color, we have those access, and that's the time to come. And we hope and we wish and praying that that's will happen soon.
I can mention that when it came to the testing, all the insurance companies, both the CCOs who work through Medicaid and all of the private insurance companies in various different forms, depending on which company, agreed to not charge copays and so forth for testing and related care. I would hope, I would expect, but this isn't final, that would also apply to vaccines.
And a couple of things. So I just want to clarify something that Matthew said. So insurance companies agreed not to charge for testing, but copays and things like that would still apply to treatments for COVID-19. And then the other thing that I wanted to say about vaccines is just want to talk a little bit about the people who are vaccine hesitant. And we are already hearing from people in that community that they will refuse the vaccine. And there's a video that has been making the rounds called Plandemic. So P-L-A-N-demic. claiming that there's a conspiracy behind it. And so to the degree that, in your community, you have folks who are vaccine hesitant, I will definitely need your support in encouraging people to get the vaccine.
Yeah, we saw what took place at the legislature with the vaccine bill, and
Yep.
some of the opponents equating it to Gestapo measures. This was
Right.
very offensive to our community. So
Right.
we'll do our best to encourage that for sure. We had a specific question about Bob's Red Mill. Is that a hot spot?
Yes, I don't have further details, but yes, there was an outbreak. I know, and somebody actually, I think, posted the weekly report. Yeah, I see a link to the new one that just came out, I think, literally this afternoon. We are starting to now report on any workplace type, or at least most. There's some limitations for privacy reasons, but workplaces where there's cases of outbreaks, of 5 or more cases. I think Bob's Red Mill is one that just happened. In all of those cases, there's quick response from local public health in particular, with support from OHA, from the state OSHA, the occupational safety and health folks, to around testing, around isolation, kind of medical advice, work with the companies. So far, we've had very good response from the companies that had these outbreaks about how to rearrange their production lines or change the way they do things in general. And it will vary based on the circumstances to avoid further spread. And including, I know at least a couple of companies, I don't know specifically about that one, doing paid time off for people who have to be in quarantine.
So we are very concerned about the economic crisis, and the state economist came out with the forecast. We're looking at a $2+ billion budget shortfall. How will that impact your efforts?
Well, that's a good question.
Yeah.
That's
So I'll take a stab and also look at my colleague Siporn Chiang, who's part of the governor's executive leadership team. So the state economist estimate was that we would be down $2.7 billion. So closer to 3 than 2. And that our state budget relies on personal income, to fund a lot of services. And so, anybody who's been around the last, 10, 20 years, like I have seen several recessions in Oregon, and just the impacts that it has on our ability to deliver services. That said, this pandemic has really reinforced the need for a strong public health infrastructure. And so, we're working hard to protect that and protect other services that serve our most vulnerable.
There is some federal funding, I'll emphasize, that is going towards specific COVID-19 response.
Yeah.
It is not covering everything by any stretch, and it also does not cover the basic loss of revenue that Jackie is talking about.
Yeah. And that's a conversation that we've had, I think, repeatedly with our congressional delegation, and that other states, I'm sure other state governors are as well, that states need federal aid that will replace lost income due to COVID.
Well, I can assure you that we've had a couple of Zoom forums with our 2 U.S. senators, and we have also communicated that urgency for Congress to step in and help the states and the large cities. Matthew, can you tell us what percentage of Oregonians do not have health insurance?
I can, it's, I think our insurance rate is like, I want to say it's like 94%.
I think it's, the last time I recall seeing a statistic, it was 94%, yeah.
Yeah, and that is, you know, heavily credited to the Affordable Care Act. That allowed us to expand coverage. You know, I think back to when there was a lottery, right? Like we were able to cover more people, and you might get selected to be covered. And thankfully that, like, we don't operate that way anymore. It's like if you need coverage, sign up for the Oregon Health Plan. So yeah, and we've worked, the state has worked with trusted community partner organizations to do outreach to hard to reach communities, so to get people covered. And I want to say that like I was the policy director at the Urban League of Portland before joining the governor's office, and the Urban League had community health workers who were helping people navigate signing up for the Oregon Health Plan and accessing it. And through that work, was able to achieve like basically parity, that as many Black Oregonians were covered as, like, you know, percentage wise as white Oregonians. And so, so we're really proud of what we've been able to do there, and, you know, absolutely want to hold on to that.
And one final question. Are you looking for volunteers to do contact tracing? And if so, how can people get involved?
So I don't know that we're looking for volunteers, and appreciate that people are offering, but I think that the emphasis is that we want this to be paid work, that we want to pay people for doing this work. And as Matthew and Siporn have talked about, like, that we're working with trusted community-based organizations where those, you know, those relationships already exist. And granted, that can also happen with volunteers. But I think that, like, at least to start out with, we want to be contracting and you know, paying people in these community-based organizations to do this important work.
On the OHA website, there is a link near the top about contact tracing. There's actually one about to learn more about it, and one to express an interest in becoming a contact tracer. But as Jackie says, well, for one, it's mostly actually being done through counties. And a lot of it will be done through community-based organizations for exactly the reasons that Jackie was talking about. And a lot of it will, yeah, the focus will be on hiring people instead of just volunteers, and on hiring people who have connections to the community. It will vary from county to county based on the local county needs, but there is a form on the website that.
I just this is a point. I just shared the link to the contact tracing interest form that you all can just take a look, and we appreciate the question, Bob. And one of the approach around contact tracing that we are taking is to engage with the model through the community health worker model by using by asking the things that maybe not asking, no, approaching with a culturally specific strategy. So we would love to have the partnership with the trusted community members, having the bilingual, bicultural community health worker program. But we have heard about the interest that want to get involved. That's the reason why there is a website available to get like who's is interested and who's actually which county, because as Matthew mentioned, that the county is actually operating with the contact tracing directly by providing all of those resources, whether having the partnership with a community-based organization or have staff on the ground. As far as we know, that Oregon Health Authority also working on getting into contracts with the culturally specific community-based organization directly across the state. So we make sure that those are all the efforts that from the state levels, not just on the local level.
Okay, well, with that, Sopor and Jackie, Matthew, thank you for sharing what is obviously very valuable information and the links to different resources. We will be sharing that with our community as well. We appreciate your time and your partnership.
Yeah, thank you.
Thank you for
to
having
all
us.
who are-
And thanks,
Yeah.
everyone.
Okay, take care, everybody.
You too. Stay
Bye.
safe.
Thanks.